Hello everyone, and welcome to your first laboratory screencast, which will cover the heart and vascular structures. We'll begin with the heart, and you'll see various illustrations from your Seeley's Anatomy and Physiology textbook. We've also taken some cadaveric images from University of Michigan's Blue Link and Netter's Atlas of Anatomy, and also some other various anatomy textbook and atlases. So we'll begin by talking about some of the layers of the heart. When you first open up the thorax, you will run into what's known as the pericardium. And this completely encloses the heart. It's not open the way we see it in this image, but it is a tough fibrous sac in which the heart is going to lay in. And so if we cut open this pericardium, that's when we're going to see the heart itself. And the heart is made up of myocardium. This is the heart muscle itself, so we know that it is going to be some cardiac muscle. And our last layer will be endocardium, which we don't see in this image here. But I really like this illustration from your Seeley's A&P textbook because we can see that the epicardium, which is your visceral pericardium, will be on this outside layer here. Then the myocardium, which is really thick here, and you can see it's well vascularized, is our second layer. And our third layer is this endocardium. So notice that this is this thin layer sitting against the myocardium, and we will soon talk about what this trabeculae carneae is. So the endocardium is made up of epithelial lining, and we'll find it within each of the chambers of the heart. So here's a cadaveric image of what you can expect pericardium to look like. And here is some of our myocardium. So if you look at this previous image, you can see all of this yellow tissue, and that's really our visceral pericardium or epicardium. And so when we peel that away, we get to see this myocardium. And so there's no fat overlying this. These are the coronary vessels that have been beautifully dissected. So anywhere that we see these fibers running along, that's all myocardium in here. And then here is a cut through your left ventricle. So you can see your myocardium right within here. And then your endocardium would be this inner lining before we see the trabeculae carneae in here. So now we're going to move into discussing some external features of the heart. We have two polar ends here, the base of the heart where we're going to see some great vessels extending off of. We also have right and left auricles. Right now in this image we can only see the right auricle, and the left auricle would be overlaying the left atrium. So we'll see some images of that later. And then this pointed projection that'll be inferior and pointed toward the left will be the apex of the heart. So let's start off with the base of the heart. When you first have a heart and it's out of the body, you need to really orientate yourself. So the first thing that you want to do is sap the heart, S-A-P. So S is going to be all the way to the right, which is your superior vena cava, and this is draining all of your deoxygenated blood from the upper half of your body. Next we have A. That is going to stand for your aorta, and this is supplying oxygenated blood to the entire body. And then lastly, we have P for pulmonary trunk, and this is going to contain deoxygenated blood within it, and will send that over to your right and left pulmonary arteries. So you may have noticed too, as we're viewing these images, you're going to imagine these structures as if they are within a cadaver or a patient. So your left is actually going to be the right. So this side over here is going to be the right side, and then your right is actually going to be the left. So this is our left side of the heart. So let's look at this in a cadaver. Here we are going to have the superior vena cava. It's really this extension. It's a little bit covered by this pericardium here. And then you have your aorta, and you could see that it is curving upward. And then we have your pulmonary trunk in this region over here. So this is just another view where you could see that superior vena cava just a little bit better. And then your aorta and pulmonary trunk. So now let's also discuss your inferior vena cava, right? We can't just have a superior vena cava, and we're going to find this, of course, at the inferior end of the heart on the right side, and this is draining deoxygenated blood from the lower half of the body, and this will head over to your right atrium. So in a cadaver, we can see over here at the black arrow is your inferior vena cava, and at the purple arrow is your superior vena cava, both draining into your right atrium. And if we look at a posterior view of the heart, we can see your coronary sinus. Whoop. So your coronary sinus is right over here. It kind of lies inferior and posterior to your left atrium and will extend on over toward your right atrium over here to also drain deoxygenated blood from the heart itself into the right atrium. So now you could see your superior vena cava, inferior vena cava, and the coronary sinus all draining into your right atrium. This is also a little image of your coronary sinus. This is from CLE's A&P, draining into your right atrium. So this is an anterior view of the heart, and you can also see the extensions of, these are called cardiac veins, that are all draining the deoxygenated blood from the heart into the coronary sinus in order to move into the right atrium. And this is a cadaveric image of what you can expect the coronary sinus to look like. So this is a posterior view of the heart. You could see some of these beautiful cardiac veins draining into the coronary sinus, and it would move on into the right atrium. So the remainder of the structures that we will be discussing will be discussed via the route of blood flow through the heart. So just as a little reminder, I'm sure you all probably already know this, but we have 4 chambers of the heart. On the right side, we have your right atrium and your right ventricle. And on the left side, we have your left atrium and your left ventricle. So now let's start off with a general overview of how flow of blood will move through the heart. We already mentioned how our superior and inferior vena cava and coronary sinus will drain blood into your right atrium. From there, we'll move into the tricuspid valve, into the right ventricle, and into your pulmonary semilunar valve. From there, we can add pulmonary trunk right in here because that's extending to become your pulmonary arteries and taking all of this deoxygenated blood. So I'm just going to add in, we'll use the color blue. We're going to add in that all of this in here will be deoxygenated blood until we get to our lungs, in which we will be able to turn it into oxygenated blood. So I'm just going to put a D over here, and then let's also use the color red to represent our oxygenated blood. So in the lungs, we are going to get oxygenated blood, and we'll just stop right there. And all of the left side of the heart will have oxygenated blood. Okay, so let's continue on from the lungs here. From the lungs, we're going to move into the pulmonary veins that carries that oxygenated blood into the left atrium, into the bicuspid valve, into the left ventricle, into the aortic semilunar valve, and into the aorta. From the aorta, we're going to deliver all that wonderful oxygenated blood to the rest of the body. The body will use up that oxygen, and then the blood will become low oxygenated or deoxygenated and send it back to the heart via the superior and inferior vena cava and coronary sinus once again. And we'll go through the route. So we're going to look at the specific components at this point, starting off with how deoxygenated blood comes into the heart. Now, whenever we're bringing blood back to the heart, we are going to use venous structures. So a lot of veins here. So our superior vena cava and our inferior vena caval openings, these are going to have the lowest pressure within the body. And then we also have the opening for the coronary sinus. We know that all of these are bringing in deoxygenated blood into our right atrium. So what are some features of our right atrium? If we look at this chamber, we will see that we have this beautiful pectinate muscle, and it's not only within the right atrium chamber, but we'll also find it within our right auricle. So that is that ear-like appendage. Auricle is referring to the ear flap. That's going to overlay the right atrium. And the area that is allowing the pectinate muscle to extend into this chamber is called the crista terminalis that we could see in this teal blue color over here. And then the last thing we're going to find here is the fossa ovalis. So let me just point that out before we move on to some cadaveric images. But on our heart, sitting between your right atrium and your left atrium is an area known as the interatrial septum. Inter meaning between, atrial referring to the two atria, and septum meaning wall. So this fossa ovalis is found on the wall between the two atria, the interatrial septum. And we'll take a look at some images as to what this fossa ovalis is, but you'll see that it's oval shaped, and we have almost like a thinning out of the wall in this region. So here's a cadaveric image of what you can expect pectinate muscle to look like. You have these muscle ridges that extend on up, and they all kind of align parallel to one another, and you'll see them extending from the crista terminalis, which is more of this bundular portion over here. And here's another view into the right atrium. You could see the pectinate muscle extending over here, and on this edge where we have the bundle, that's your crista terminalis. So this is just showing us some of the openings of your of the veins. So here's our superior vena cava bringing blood in, inferior vena cava, and your opening for your coronary sinus. Now we see this depression here on the interatrial septum as the fossa ovalis. So let's talk more about that fossa ovalis. So the fossa ovalis is what we see postnatally. When we were a fetus within our mother, we actually had a hole in our heart, and this was called the foramen ovale. So blood would be able to shift from the right atrium into the left atrium. And so as we're born, this has a little flap that will close up this wall and become a depression known as the fossa ovalis. So here we could see it properly closed. Now sometimes this is not properly closed and we get an atrial septal defect, and we could call that a patent fossa ovalis. And I believe there is one on a cadaver, so hopefully we will see that this quarter. So now our deoxygenated blood is going to move from the right atrium through the tricuspid or the right atrioventricular valve. You'll see that these valves have various names, so make sure to know all of them. So here is our right atrium, and we are looking down inferiorly to your tricuspid valve. So in here we're going to see that there are a lot of cusps, and we are going to identify this on this slide here. So here is your cusp, and as you can imagine, this is called the tricuspid valve because we have 3 of these cusps, and extending from those cusps we will have chordae tendineae, so these string-like structures. So these are what's known as your heartstrings, and that is going to attach to a cone-shaped muscle that we will find in the ventricles called papillary muscles. So by these papillary muscles contracting and relaxing, we are able to open and close your atrioventricular valves. So notice too that all of the AV valves will have the same component. They will have the cusps, the chordae tendineae, and the papillary muscles. And these components extend into the next chamber, which is your right atrium here. The other thing that we could see within your ventricles is muscle known as your trabeculae carnae. So we don't see the trabeculae carnae too well. And I think I have a image coming up in your left ventricle where you could see the trabeculae carnae just a little bit better. So once we're in the right ventricle, this deoxygenated blood is then going to move into your pulmonary semilunar valve. And your pulmonary semilunar valve, as well as all semilunar valves, will only have 3 cusps. So you could see at this point we are at the smiley face in our heart. Here was our right ventricle. So we've extended up toward this pulmonary semilunar valve. And so if we were to cut the heart at this level over here, we would be looking down upon over here your pulmonary semilunar valve. And you could see that it has the 3 cusps, 1, 2, and 3. Now anterior to it, you may be seeing this valve over here as well. And this is your aortic semilunar valve that we'll talk about in just a few minutes. So we won't see any chordae tendineae here. We won't find papillary muscles. Instead, we are going to see that they have the cusp, of course, and then the flap known as the lineule, okay, or lineulae. And then at the very center of that lineula or pocket-like structure, we have a nodule. So we like to compare this to an actual pocket. So that portion outside the pocket is going to be your lineule. And then imagine that there is a little fibrous nodule right in the center of it. Now, when these 3 cusps come together, those nodules help to close up that center compartment so that blood will pool into the pockets but not go through that center area. So it really does a great job of closing that valve. So now the deoxygenated blood is going to move past this pulmonary semilunar valve and into your pulmonary trunk. Remember, that's the P within our sapping of the heart, and it's really like an extension cord. It just helps that blood shift upward and next into your pulmonary arteries. So we have one right pulmonary artery and one left pulmonary artery. And so if we're looking at our image, we were here at the pulmonary semilunar valve, went into the pulmonary trunk, and now we're extending out through the left pulmonary artery and the right pulmonary artery. So here is an image, a cadaveric image of what this looks like. Here's our pulmonary trunk, and this would be our left pulmonary artery, and then the right pulmonary artery you can't see too well over here. It would be extending posteriorly this way. So now our blood is going to move from those pulmonary arteries into our lungs. So this is a picture of your lungs, and at the area which we call the root of the lung is going to contain our vessels. We'll find our pulmonary artery extending over to the lungs, but also once that blood becomes oxygenated, we are going to move back to the heart through 2 pulmonary veins on each side. So here are our right and left pulmonary veins. You can see in our illustration here, we have the pulmonary veins. These are your left pulmonary veins draining into your left atrium. And here we see the openings to your right pulmonary veins, and you can see the extensions coming off of what would be the root of the lung on this side. So here's a cadaveric image of these structures. This is more of the anterior surface of the heart. Here is the posterior portion of the heart. And so these would be your right pulmonary veins draining into your left atrium. And of course on the other side, so extending to through your screen would be your left pulmonary veins posteriorly, or I should say posteriorly and to the left. And here's another image. So this is more of a posterior view of the heart, and you could see your full openings. So this is going to be your right pulmonary veins, and we have your right pulmonary veins over here. So now our oxygenated blood is going to move into your left atrium, as we said before. So when we're looking at the left atrium, you may have realized that we don't really have pectinate muscle in here. The only place we're going to have that is within the left auricle. Remember, that is the ear-like appendage that is going to lie right within your left atrium. And so I always get the question, what are your auricles for? And as far as what I've found is that it's just an extra area for storage of blood. So we have this smoothed appearance of the left atrium. So it's still made up of cardiac muscle, though we just don't see those pectinate muscles in here. And so not too many other features here in the left atrium. So where that oxygenated blood is going to go through next is your bicuspid mitral or left atrioventricular valve. And so here you may have noticed that it's not tricuspid anymore, but bicuspid, and bi means two. So we're only going to have two cusps here, whereas your tricuspid would have three. And so because this is an AV valve, we are also going to have the chordae tendineae and the papillary muscles associated with it. I quickly want to mention too that this valve is also called your mitral valve because it was named after a mitre hat, which is the hat that the Pope wears. And you may have noticed that there are two flaps on that hat. So they thought, let's call this the mitral valve because it has two cusps like the mitral hat. Okay, so that moves us into your left ventricle. And you could see here that our myocardium of this left ventricle is 2 to 3 times thicker than in the right. And we can now see a better view of what that trabeculae carneae muscle will look like. So it's almost like a bit more webbing than compared to your pectinate muscle, which has a little bit more parallel ridges to it. And here we could see those beautiful chordae tendineae strings and your papillary muscle here, that cone-shaped muscle. So here's another view as to what that papillary muscle looks like. So now our oxygenated blood is going to move through our very last valve, which is the aortic semilunar valve. And here we are going to see the 3 cusps and the lunulae, 1, 2, 3, and those nodules at the very center of the lunulae. You may have noticed that there are these little openings here in our aortic semilunar valve that we did not find in the pulmonary semilunar valve. And that's because at the base of the aorta, we will have openings to our right coronary artery and the left coronary artery. So we're going to discuss that a little bit more once we get into our vascular structures. So now our oxygenated blood will move through into your aorta. So here is a superior view of the heart, just to orientate you. Here is our aorta, and this is your pulmonary trunk. And you could see a little bit that there's going to be an extension off of the aorta here that will give rise to those coronary arteries that we just discussed. So your aorta is the largest artery within our body. We will also have the highest amount of pressure because we're pushing all of this oxygenated blood from the left ventricle to the rest of the body. And the aorta has 3 different parts. We have the ascending aorta, and I'm going to switch to another cadaveric picture so you can really see this. So it's this portion moving on up, and you could beautifully see the origin here of your coronary arteries extending off. And then we have your aortic arch. So at this point, moving on up, and I like this picture where the heart has been taken out, but we left a portion of the aorta in place. So this is your aortic arch, and it's giving rise to these arteries here that we'll discuss very shortly. And then it'll extend posteriorly and become your descending aorta. And the descending aorta can be divided into a thoracic aorta and an abdominal aorta. So now we're going to move into our vascular structures. Our illustrations will be from the same sources. And just keep in mind, anytime you see a single A, that stands for artery, double A's are for arteries, V is for a vein, and VV are for veins. So first we'll discuss the arteries of the body. Well, we're going to start off at the aorta, and this is again a superior view of the heart. We could see your aortic semilunar valve and a part of the ascending aorta, which we've mentioned several times now, gives rise to your coronary arteries. So this is going to be your left coronary artery, and over here we have your right coronary artery. And this term coronary actually means crown. So they thought this creates a crown around the heart, just encircling it. Okay. So now let's take a look at the aortic arch. If we look at the heart once again, here is our aortic arch, and branching off on the right side, we will begin with the brachiocephalic trunk. Now we can't see this in this cadaveric image, but off of your brachiocephalic trunk, we will have your right subclavian artery and your right common carotid artery. In the very center of the aortic arch, you will have your left common carotid artery that will head up toward the head, and then you will have your left subclavian artery that will extend and move to supply the upper limb. Now, why would you think that the left common carotid and left subclavian come directly off of the aortic arch, but on the right side, we need this brachiocephalic trunk? Then we give off the right subclavian and the right common carotid. So if you guess that this is because the heart lays on the closer to the left side of the body, you are correct. And so I always like to refer to the brachiocephalic trunk as being an extension cord. So if we break down that word brachiocephalic, brachio is referring to the arm, cephalic is referring to the head. And so it's giving off branches such as the right common carotid going toward the head and the right subclavian going toward the upper limb. So here's another view where you can see that branching. So here is your brachiocephalic trunk. Once again, this is coming off the aortic arch, which we would find right in here. That brachiocephalic trunk gives rise to the right subclavian artery and your right common carotid artery. Then in the center of your aortic arch, we have your left common carotid artery. And lastly, all the way to the left of your aortic arch, we will see it give rise to your left subclavian artery. So now let's take a look at some of the branches off of the descending aorta, and we'll come back to those other branches going toward the head and the upper limb later in the screencast. So here you could see your ascending aorta has been reflected so that we can focus on your thoracic aorta. And we call this thoracic aorta because we find this portion of the aorta in the thorax. And so here you're only really going to find extensions coming off called your posterior intercostal arteries. And remember that these can be found within the costal grooves of your ribs. So we would have to peel away some of the parietal pleura that would be found over here in order to see these posterior intercostal arteries.